Hello, my name is Leah. My full name is Mahalia, but I go by Leah, just the last three letters of my name, Lia, and I use she, her pronouns. I do have some healthcare experience. I worked in a dental office when I was in my early 20s, left and worked in the service industry, and then came back to healthcare 3.5 years ago. That's when I became a CNA, and that's what I am currently doing. I want to become a nurse because I like taking care of people. I think most of us here can probably relate to that. And I just like nursing in particular because you do get to spend a lot of time with patients and kind of get to know them a little bit more personally, I guess. Being a CNA, I've really enjoyed like the time you get to spend with patients, like getting them dressed or taking them to the bathroom or brushing their teeth or, just in that way. But I do kind of want a little bit more challenge. So I decided to pursue my RN, which is really exciting. And I really like the freedom and flexibility of the industry or of like the nursing job in general. I just like that there's lots of opportunity to grow and like change directions, learn something new. When I watched the video, one of the things that came to mind is as a nurse, you're often meeting both patients and their loved ones for the first time, and it's usually in a pretty private, intimate, and challenging time in their lives. And so I think because of that, it's really important to take your role to heart and just hold on to that compassion and empathy even when it becomes stressful or you're having a bad day. I just think that nursing is obviously just like a very caring, compassionate job, and we need more people with heart. I communicate best. I really appreciate calm and clear and direct communication. I think I'm still working on being a little bit more confident and clear with my own communication. I always think that baseline and respect is also very important. If you are late or need to miss clinicals, you will call your clinical faculty member. If you're going to be late, you want to call no less than an hour before clinicals begin. If you need to miss a clinical simulation, you want to email simulation@spscc.edu, and again, no less than 1 hour before CSIM. If you have specific clinical or lab needs, email your lab instructor on Canvas. And then the SDAOH clinical activity, from my understanding, shouldn't cost anything, and intercity transit is free. Clinicals will be at Lacey Post Acute, and you should arrive at 5:45, about 15 minutes before start time. And for the pediatric and well elder projects, you should be able to start anytime, earlier rather than later. And then for the pediatric clients, the age group should be between 3 months to 5 years. And for the elder project, elder project clients should be over 65 or 65 and older. What is the muddiest point? I don't know I feel like the video was pretty clear. I think if anything, I just got a little bit scrambled in my brain when it came to keeping track of some of the larger projects, and just trying to remember to start working on them, when to start working on them, when they're due. Yeah. And one unique thing, I guess the one thing I thought of is that I really love coffee, but I can't have more than 1 cup or else I sort of become a little bit dysfunctional, I guess. Like my brain gets blurry and I get really shaky, which is very sad to me because I really do love coffee and I wish I could have more than 1 cup without falling apart. Yeah, anyway,